Good morning. Can you hear me? Not really. I can't turn it up. Can you hear now? Can you hear in the back? Yes, thank you. All right, let's finish our male reproductive system. And we had shown some slides preceding this on the subject, so you know roughly what we're going to cover. But we start with the penis. But first, I want to point out, would you please all fill out an evaluation? We were told specifically that it's essential we get these so the administration knows what we're up to. So please do. It gives us ideas of what's wrong, what to improve on. I mean, we look at them, we do take them seriously. So thank you very much, and please do fill them out. If you don't have a Scantron, please, they're here. For those who are coming in late, they're passing them out there, but we have some here as well. Today, right here before you leave. They'll be collecting them at the end. All right? Anything else? No, we're fine. Oh, does anybody have a syllabus for 131A here in your notebook? You have, perfect. Can you let me look at it after class? Thanks a million. So, this is male reproduction, and we'll just start with the penis and take a cross section. We'll have 3 cavernous bodies here. Two. There'll be the corpora, cavernosa, penis. So we'll put them here. They're cavernous. Blood sinuses, and the corpora, 1, corpora, cavernosa, urethra, which we'll put here, with the urethra internally here, and the cavernous sinuses around it. So with parasympathetic stimulation, blood rushes into these cavernous bodies. Parasympathetic stimulation. Blood fills cavernous bodies. And the literature tells us it takes about 50 cc's. So we'll put 50 cc's plus or minus. And the rush in of blood, of arterial blood, will then block venous flow, so you get erection. So the erection is blocking the venous flow from the penis. After the cavernous bodies fill. All right. So then let's go to semen. We're not going to go into further detail. It gives just the basics. Can I take all this off? Thank you. Semen then. Well, we know that it's going to have the secretions from the 3 glands that we mentioned. Secretions from, what's the matter? What'd we do? Pardon? The computer said something. What did it say? All right, we'll go on. From the, let's see, what's the name of the gland that's on the posterior surface of the urinary bladder? Seminal vesicles. Isn't that what you said? And what's it secreting? Fructose to nourish the sperm, right? And then we had the prostate gland. Which of these gives off more of the secretion for it constituting the semen? No. 60%. Seminal vesicles. Prostate anywhere from 15 to 30%. And prostate, what does its secretion do? Activates the sperm, right? And then we had the third, the little pea-sized ones, bulbo, urethral. We said they're pea size. What size did we say that prostate was? Walnut size. All right, and what are the bulbourethras doing? They're neutralizing the acid in the urethra. So, neutralize acid in urethra. And then, of course, we have the sperm. These are giving us the fluid. How much fluid did we say for one ejaculation? One ejaculation, ejaculation. 2.5 to 6 cc's per ejaculation. And how many sperm? 200 times 10 to the 6 per ejaculation. Average. If you have less than 20 million per ejaculation, what do we call it? Sterility. Sterility. Having trouble conceiving, check, be sure the sperm count is high. All right, well, with that, we just took a few minutes to get started. Then we'll start our review. And what I want to say about the review, since we don't have time to give the skin, I'm going to give questions in the review and give you answers. So you're going to be learning. As we said, the review is equally learning. Why do you laugh? Oh, you're happy. Okay. You never know. But I just want you to know that I'm not going to give a whole lecture on the skin, but it's a shame because the skin is the largest organ in your body. And you probably never knew that. It is dynamic. So we'll give you about 2 or 3 questions in the text. All right, we better go because we've got lots to cover. First slide, please. Whoops, we need to keep lights on, please, a little bit. Can you see now? You're fine. All right. All right, the first one we're going to see is that what organs are these? Kidneys. Good. Well, the kidneys lie on the psoas major and on the quadratus lumborum and are considered to be A, in the peritoneal cavity? No. Anteperitoneal? Superior peritoneal? Retroperitoneal. Yes, you agree. All right, so the left kidney, this is an artist's rendition, so they didn't know position, but you know it. Is the left kidney between the T5 to T7? How about T6 to T12? How about T12 to L3? Okay. All right, next one. What organ are we in? Kidney, good for you. Now, is this part of the nephron? Sure. Right? Is the distal convoluted tubule part of the nephron? Sure. And what do we have that's going to come down in here and loop back up? Is it part of the nephron? Now, when these collecting ducts come down, what are they going to go into? The pyramids. Those are still collecting ducts. The minor calyces, right. So is a calyx part of the nephron? No. New slide. Now, can anybody tell me what part of the nephron this tubule is? What'd you say? Proximal convoluted tubule. And how do you know? What is this? A brush border. Good for you. Now, which substances are not absorbed in the proximal convoluted tubule? Is sodium? Yes. Is glucose? Is water? What do you mean no? 100 cc's are absorbed here. Was that a person who comes to class or a person who just comes to review? That's a big difference, isn't it? Right. Don't you who just come to the review feel guilty a little bit after all these people worked so hard to learn this and they call it out and you just write it down? Don't you feel a little guilty? I would. Is phosphorus absorbed here? No. All right. New slide. All right. What is the most important structure in creating the glomerular filtrate from this structure here? Right. I heard it. Your basement membrane. The next one. No, stay here. Stay here, please. I'll use it for the next slide. All right. If 1,200 cc's of blood are flowing through this structure per minute, how much glomerular filtrate will be caught off in this Bowman's capsule? 125, right? How much is going to be reabsorbed? 124, right. And so how much urine are you forming? 1 cc, right. New slide. All right, what are these structures? Where are we first? What tissue? First identify it. Pardon? No, it's a good guess, but you don't have all these loops of Henle in the thyroid, do you? So when you're trying to identify a structure, look at the whole picture, right? So what do you think they are? Collecting ducts. Good for you. Now, where does antidiuretic hormone coming from? What part of the body? Where's it coming from? From the pituitary, but where is it formed? In the hypothalamus, right? It's just being stored in the posterior pituitary, right? So, now, where is it going to act on the kidney? The collecting ducts, right. These are the collecting ducts. They're cuboidal epithelium. Very different from our little loop of Henle, which is here, because these are collecting. They're part of the excretory portion. They're taking the urine away. All right. Now, if there is a deficiency in the antidiuretic hormone acting on these collecting ducts, what do we call the disease? Diabetes insipidus. Good for you. New slide. Now, where are we? We have vessels coming in and out here. This is our glomerulus, yes. But what vessel is coming in? Afferent arteriole. And what vessel is close to the afferent arteriole? The distal convoluted tubule, right? And so what is in the wall of the afferent arteriole that makes it important? The what? The juxtaglomerular apparatus. Good for you. And so what is it secreting? Renin. New slide. I thought I'd fool you. Have you seen that structure before? What's the cardiac output? How much of the cardiac output does the brain get? That's where it's getting it from. But what's the amount of cardiac output that it's getting? 1/4. Good for you. What amount does the kidney get from the cardiac output? 1/4. I just want you to appreciate that fact, that your kidneys are getting 1/4. So between the brain and your kidneys, they get half of the cardiac output. You think you're going to remember that 5 minutes from now? Will you remember it 6 months from now? I hope so, because it's important. All right, next one. What are we showing here? Urinary bladder, but specifically trigone. And what forms the trigone? What are these? What up? Ureter. Don't confuse urethra with ureter, right? Ureters are coming from the kidneys. Urethra is coming from the bladder. So learn to say it so you don't confuse. So what's this? Urethra. I don't hear all of you saying it. So forming your trigone. Well, that's a lot better. Don't you feel better participating rather than just sitting like lumps? And I would. All right. So you've got a urethra here, you've got 2 ureters here, and what have we formed? Trigone. New slide. Anybody guess where we are? Look at this kind of epithelium. You've seen it before? It's not simple squamous, is it? Pardon? Bladder, did I hear? Which kind of bladder? Good for you. What kind of epithelium do you have in the urinary bladder? Transitional, right. Where does transitional begin? You just saw your collecting ducts were simple cuboidal. So it's going to be in the ureter, actually coming down. And so you're going to see it in the urinary bladder. So when you're filling your bladder as you're sitting there, this is going to go out and it's going to get thin. But as long as it's an empty bladder, this will get thick. So it's transitional epithelium. Now, the urinary bladder lies blank to the non-pregnant uterus. Anterior, good for you. Now, why is the relationship of the ureters to the uterus of concern during a hysterectomy? You don't want to cut it. But why would it be likely that you might cut it? What's the relationship between those ureters and the uterus? They're right in front, aren't they? They're anterior to that uterus. All right, new slide. Where are we? The cochlea, right? This was not covered on the last exam. We go back to the ear for this exam, right? Because it was the lecture before, but we gave you a handout on it. So we'll see how many of you studied the handout. So the receptor for hearing is called what? The organ of Corti. Good for you. Now, as we look at the cochlea, let's see how many really have studied. Is the organ of Corti here? Is it here? Is it here? Yes. Did you study or get that in another class? Both? Okay. New slide. New slide. Aha. What have we got here? What do we call this? Is it part of the external ear, the middle ear, or the internal ear? External ear. You know that one. Good. All right. Now, what is the tube that goes back from the external ear here? The external auditory meatus. All right. Now, as young anatomists, you've got to build an external auditory meatus. What kind of epithelium are you going to put there? Stratified what? Squamous, sure. You're not going to put ciliated, are you? You're not going to put single epithelium. I want you to use your knowledge now to figure these things out. So sure, the external auditory meatus is lined with stratified squamous epithelium. Now, as we go down the external auditory meatus, what's the first structure we're going to encounter that will fill it? The tympanic membrane. Right, but now you've got to build a tympanic membrane. What do you think you're going to use? You know, there are 4 kinds of tissue. You're going to need connective tissue, you know that. But now are we going to need epithelium? You're not just going to have connective tissue there, are you? You've got to cover it with epithelium. So what kind are you going to use? Your stratified squamous like you did within the tube. So, but you've got the middle ear on the other side. So what do you want on the other side? If you've got stratified squamous and you've given it connective tissue, what do you want on the inside? A mucous membrane, right? So what are the 3 components of your tympanic membrane? Connective tissue, stratified squamous, and mucous membrane. Sure. Have they made successful replacements for your eardrum? Do you ever appreciate your eardrum? We wouldn't have any session, would we, if you didn't have one? Remarkable little structure. All right. Next slide. Where are we? Testis. How do you know testis? Acrosomes. All right. So the germinal epithelium in the what produce thousands of sperm throughout life. What do we call the tubules? Seminiferous tubules. Yes, say it. Good. All right. It's 22. I've skipped one, but I'll give it to it orally. The eustachian tube connects the nasopharynx with what? Middle ear. You all know that one, right? Now, I didn't have a slide for it, so the membranous labyrinth, where are we? Ear, right? Follows the outline of the bony labyrinth, except for, which one? Semicircular canals? No. Ampulla? No. Scala vestibuli? No. How about the utricle and saccule? Yes. It's the fourth one, so it better be yes. All right, new slide. Where are we? Give me specifically where we are. We just did it. Pardon? I hear lots of noise. Seminiferous tubules, of course. Now, what cells in the seminiferous tubules develop into the blood testis barrier apparatus? Sertoli cells. Good for you. New slide. Now this one I didn't get you, but let's see if you can guess it. The pH of semen is about what to neutralize the acid in the vagina? You're doing all the bases, but the middle one, what's the one? 7, right. All right, new slide. So, what vesicles are these? Seminal vesicles. What's this coming in here? Pardon? The vas deferens. Good. What did the vas deferens in the seminal vesicles form? Ejaculatory duct. Right. Next one. Now we have a gland here. What gland is this? Everybody should know that. Parotid. Right. So if you're defining to somebody, they say that the parotid is a gland that experiences mumps when there's a mumps virus, and they'll say, well, where's my parotid? What are you going to say? Not feel. You can feel it, but what are you going to say? Anterior and inferior to what? Anterior to the ear and inferior to the ear, slightly. How about using the external auditory meatus as your landmark? Same thing, right? Anterior, inferior. New slide. What's the outer layer here called? Enamel, right. Did you know you looked like that when you were forming teeth? You had little deciduous teeth. So what's the most stable, hardest tissue in your body? Your enamel. New slide. This is also in your mouth. What is it? Pardon? I don't hear it. No? No? It could be. Because if you knew it was lip, what would you have out here? Keratinized, very dead layer. But what else do you have in your mouth then? What do you call it? What's the technical term? Gingiva. That's what we're at. So now, what are the 3 substances that keep your teeth within their sockets? 1, gingiva. 2, cementum. Periodontal membrane. I have a good, loud, clear voice here, saying them specifically. Thank you. New slide. All right, what structure is this? What nerves are associated with it? 5, 7, 9, 12. Right. All right, new slide. What are these? First, where are we? Tongue. What do we call it? A what? Papilla. Papilla. We showed you an EM of these. They're very marked. So what do we have on the walls of a papilla? Pardon? Taste buds. Right. Can I go back one, please? This one. I want to see if it showed this, what I wanted from it. So we should have right here, we've got our epiglottis, and then we've got cartilage here. What cartilage is this? Thyroid cartilage. All right. So if we go down the thyroid cartilage, past another cartilage, what's the next cartilage? Cricoid. And then we go down below the cricoid. What is below the cricoid? Pardon? No, I want what cartilage? The tracheal rings, right. Now if I go posterior, what am I going to have here? The esophagus. So what vertebral level are the trachea and the esophagus beginning at? C6, right. You did say C and not T, didn't you? Yeah. C6. New slide. Next one, please. All right, can anybody tell me where we are? Skin, right. This is what we didn't have time for. So, the outer layers of the skin are called what? Epidermis. Epi means what? Upon. So what's all of this below? Dermis, all the connective tissue, nerves, blood vessels. There are no blood vessels in the epidermis. This is just a sweat gland going up. So the principal layers of the skin are the epidermis, the dermis, and what's the last one? Hypodermis. What's common in the hypodermis? Fat cells. New slide. This is what you'll get in advanced anatomy, the omentum and all of this. But what I want is what is lining the abdominal wall. Peritoneum, but what kind of peritoneum? Parietal peritoneum. Good. New slide. What do we call this area of the stomach? Cardia. So what do we call when chyme gets into the esophagus? Heartburn. Does that seem like a misnomer? Yes, it is. New slide. What tissue are we in? Stomach. Good for you. Somebody knows this histology. If you're going to medicine, you've got to know your normal histology. You go into pathology and you'd flunk if you don't know your normal pathology. So there are reasons for drilling. Drilling and drilling. So this is the mucous membrane of the stomach, and it's got three types of cells. What type of cell here? At the top? If we've got one kind of cell here, some in the middle, and some down here, what kind do we have at the top? Mucus cells, right. Why do we need those mucus cells there? Sure, because what constitutes the next layer? Parietal cells, or oxinic cells. Those who work with John Forte and MCB, he calls them oxinic cells. So I want you to know there are different terms for these parietal cells. So what are they secreting? HCl, good for you. So what's the pH of the chyme? 1, good for you. So what's down here at the base of these glands? Chief cells. And what are they secreting? Pancreatic enzymes. Are you listening to me? What should I say? Pepsinogen, good for you. See, we always do that. I gave Jill some data the other day. We purposely, when you have a lot of data, make one wrong and see if they're listening to you or they're correcting it. If they don't catch that, they didn't check your data very well, right? But I know you're listening. All right, next one. Oh, let's go back, because I want to stay at the stomach. I didn't have a slide for it, and I didn't teach this, but I think it's important for you to know it. So, renin, spelled R-E-N-N-I-N, is produced in the infant stomach. Why does the infant need this kind of renin, R-E-N-N-I-N? Because you'll see renin down in the kidney and renin in the stomach, and you'll say they've misspelled it, but I wanted you to know. Why does the infant need it? To curdle the milk so it stays in the stomach and doesn't just pass through. So R-E-N-N-I-N comes from these stomach glands and will curdle the milk for the infant. You don't produce it. New slide. Now, I had to get some abnormal ones here because I couldn't find a good one. So what we want to know is, what do we call this tube? Fallopian tube. You all know that. What else do they call it? Uterine tube. What else? Fallopian duct, or just duct, right? And so the ovum travels down it. How long does it take the ovum to travel down the fallopian tube? 4 to 5 days. Is it 4 to 5 or is it 3 to 4? It's 3 to 4, right. 3 to 4 days. Let's go to the next question. Keep the same slide. All right, what's the thickest part of this structure? What is this structure? Uterus. What's the thickest part? The fundus. Up here, because it's got to contract to expel that fetus. What's the thinnest part? If you were building a uterus, which layer would you want thin? Cervix, sure. See how it has to expand for that head to come through? You want that to be thin down here. All right. So a pap smear. All females have had pap smears. Where are they getting the tissue from? From the cervix, right. Because it's the thinnest, it's the inferior area, so it's easy to come up and get a smear from it. New slide. What in the world is this? I'm sorry? Endometrium. Hey, good for you. That's fine, but what stage? What's the first stage in building up the endometrium? Proliferative, right? And what's the second stage? Secretory. So you can see this is secretory. So this is after ovulation. It's expecting a fertilized ovum to come in. So it's all secreting. But now which steroid hormone is high during this period of progesterone? Right. This one I have no slide for. So sperm are viable for how long? 3 days. Wow. So what day of the cycle does ovulation usually occur? 14th. Two important things to remember. 14th day, viable for 3 days. All right? Well, we're educators. We're not guessers, right? Okay, 45. That new slide. Can anybody guess where this is? We're still in the female reproductive system. Where do you want stratified squamous epithelium? The vagina. Yes, you do. Now, which function is not associated with the vagina? Serves as a lower part of the birth canal? Sure. Receives seminal fluid from the male? Sure. Provides many secretions? No. The vagina has no secretions of its own. It gets all its secretions from what's just superior to the vagina? The uterus, sure. We saw all these secretions, but the vagina benefits from those. It does not have secretions. New slide. Where are we? Penis, no problems identifying there. But doesn't it look like a mask? I mean, we scientists aren't always serious. There are lots of fun when you're looking at things, but here we go. So, what is the counterpart to this erectile tissue in the female? The clitoris. But what's the main difference? No urethra. See, he's got his urethra down here in this mass. She does not have her urethra. It's separate. Now, I had no slide for this one. So see if you can tell me from what we've learned. You have to really think, because we didn't put it together. You're going to put it together. The easiest approach to the vas deferens for a vasectomy is through the... Think of where the testis is. Think of where the vas deferens is going. Where are you going to pick up that vas deferens most easily? Scrotum, sure. You don't want to go up in that inguinal canal. You don't want to go in that body wall. Stay exterior to the body wall. Catch it in the scrotum. Right? Because it's got to be coming from the testis, from the epididymis, right? They're all in the scrotum. So that's where you have fun working with things for common sense. Right? Okay. All right, I just gave you this one when we were over here. It takes about 2 weeks for the sperm to pass through the epididymis to complete functional maturation. You remember how long the epididymis was? 20 feet. Sure. Thank you for those who helped me. They will never forget it. I'll see them 60 years from now, and they'll still remember that because they volunteered. All right, but we know that when they're finishing going through that epididymis and going along, they're still immobile. They receive secretions from what to become mobile? Prostate. Right, they're already in the urethra before they become mobile. Just another way of reviewing. Okay, new slide. Where are we? Here. Looks familiar, doesn't it? Doesn't look familiar to me. I don't know whether I brought it in. So I'll just give you the question. Which is incorrect on why we need a blood-testis barrier? That the seminiferous tubular fluid is different from interstitial fluid. You see, the seminiferous tubule is a tubule. Interstitial is between the two tubules. Is that fluid different inside the seminiferous tubule than outside it? Yes, it is. Does the seminiferous tubular fluid have high androgens? Yes. Does the seminiferous tubule have high estrogen? Yes. See how you'd failed this one? So we need a blood-testis barrier to decide what's going to go to those sperm from the Sertoli cells. All right? No slide on this one. Which region of the sperm contains the chromosomes? Sure. Right. All right. You've just got 4 minutes. Let's move along. Next one. Next one. Where are we? Where are we and why? Well, what are these? They go way up and curve up. Villi, sure. So where are we? Large intestine or small intestine? Small. Yes. Who said large? These are villi. You only have them in the small. But how do you know what part of the small intestine you are from this slide? Where are we? Ileum. Why? Where are Peyer's patches? You mean Brunner's glands, don't you? There's a big difference. What are Peyer's patches? Masses of lymphatic tissue. What are Brunner's glands? Glands secreting what? Yeah, why? Neutralize the acid in the stomach as soon as all that chyme gets in here. That's what we have here. So you know immediately that this is part of your villi, and these are Brunner's glands. Where does most absorption of your food take place? In the duodenum, yes. Now, what do we call the base of these villi down here? Crypts of Lieberkühn, right? Next slide. Now tell me where we are. Looks like ileum, doesn't it? But it's really the appendix. The appendix is just the first part off of the large intestine after it leaves the ileum. So to fight any more bacteria, you've got that appendix right there. But they don't call them Peyer's patches, they just call them lymphatic nodules here. But you are right, the ileum will have these too. To destroy microorganisms. Any idea where we are? We've been there once before, just a few minutes ago. Is it small intestine? No, why not? No villi. These are packed together. There are no spaces in between. No crypts. So where did we see glands that come all the way down through the mucosa? Stomach, right. So, what is absorbed in these glands? Alcohol and aspirin, right? Everybody knows that. But that bothers me when they tell you to take a glass of milk with your aspirin. What are you doing? Coating your stomach with fat? Are your aspirin going to be absorbed? When do you want that milk? With alcohol, if you don't want the effects. All right. Next one. Here we are. What do we call this structure? Large intestine. So what function is not associated with the large intestine? Well, first, that it receives unabsorbed food. Yes. It absorbs water. Yes. I mean, this is a main source where you're getting rid of all your gastric juice, all your saliva, all your nasal mucus, right? Your large intestine, very important. It lubricates feces, right? Does it produce most of the digestive enzymes? No. New slide. Where are we? Did I hear it? Skin, right. Back at skin again. Why do we put it in? So what function is not associated with skin? It regulates body temperature. Sure. Produces hair. What's this? Hair follicle. What's this? What kind of muscle? Erector spinae muscle. But what kind of muscle? Smooth. Good for you. And what kind of tissue is this? Connective tissue. What's this? Gland. Yep, you're learning. Now, can the skin completely replace the function of the kidneys? Do we excrete through the skin? Through what? Sweat, right? Sweat has salt. It has lots of things that your urine has in it. It also has urea. Did you know that the sweat has urea? All right. Hey, guess what? We finished. We made it. We made it. So, good. Thank you. Now, I love you dearly, and you know that. All right. All right, well, I expect you all to get A's now. I've done my job, you've got to do yours. And then remember it. That will really be fine. And if you want to remember it well, come teach the little kids in 33. Please, with your evaluations, please pass them to, is Jill back there? No. What do we, they put boxes, whoops, I just got rid of my, this part. There are boxes, no. There are boxes by the doors as you walk out. So please, please put your evaluations in there. They count a lot for building this class and showing people what we're up to. Thank you. Yes.